called Healthcare Spotlight, and it's where you go over different physicians and their interests outside of medicine. So I find that really interesting. And so we've advertised with the magazine for 5 or 6 years, and that's been beneficial too. So I think overall it's been real helpful, and I'm glad you guys are involved with this. Especially as a subspecialist, as an allergist, I can keep up with my own specialty, but it's nice to find sort of new medical information with other specialists and subspecialists.
I'm Dr. Ricardo Kohlberg. I'm a non-surgical orthopedic and sports medicine physician. I work with Andrews Sports Medicine and Orthopedic Center. We have offices at Pelham, Birmingham, downtown Birmingham, and the Hoover area. The Birmingham medical news has become essential for me to keep up to date with the latest news in local as well as national events that occur in national news and local news with regards to the medical community. Frequently, patients ask me about new procedures that are being done that other doctors are doing, and oftentimes I find myself going back to articles that I read from Birmingham Medical News that inform me about those procedures so I can answer those questions to the patients. Birmingham Medical News has been a great source to learn about what my colleagues in other specialties are also doing and stay informed.
Birmingham Medical News is a terrific avenue of communication between a primary care physician or any physician with a large patient-based referral source to a subspecialist. Between the information that's obtained of new approaches in orthopedic surgery to advanced diagnostic tools of prostate surgery and prostate cancer, as well as treatment regimens, to the new medications with Parkinson's disease from our neurological consultants. That avenue in communication is priceless when it comes to a referring physician.
I'm Matt Scherer. I'm an anesthesiologist with Anesthesia Services of Birmingham. I think Birmingham Medical News is a great resource for physicians in our area. Healthcare is a rapidly changing field, and to be able to keep up with new practices, new techniques, new business models, I found it extremely useful. So also extremely easy to work with, and I'm looking forward to a long relationship with Birmingham Medical News.
Well, I think the Birmingham Medical News is a wonderful publication. I've enjoyed reading it for a number of years during my private practice. They certainly have helped our practice in a number of ways. They've been very responsive in helping us with ads, very creative, patient with some of our requests, and being willing to work with us over a period of sometimes several different versions of ads to get what really seems best and to our satisfaction. I would strongly encourage physicians and other medical groups to read the Birmingham Medical News and certainly take advantage of their willingness to help them out with advertising and marketing their practice.
We're fortunate in Birmingham to live in a world-class medical community. We've got world-class hospitals with world-class doctors performing world-class medicine. One of the problems with this highly subspecialized area is the ability to keep up with what's going on outside of your own bailiwick. And it's that gap that Birmingham Medical News began to fill about 10 years ago. And what it's done is it's allowed each area in medicine to communicate with other doctors in the area about what's going on in their specialty, particularly innovations and new techniques. At Urology Centers of Alabama, we've had a lot of changes, particularly with regard to prostate cancer, particularly like the robotic radical prostatectomy and the changing landscape of prostate cancer screenings. That's been a little hard to keep up with for the average physician, particularly the primary care doctors, and the Birmingham Medical News has been an integral part of our ability to get our message out, and it's just been invaluable. In addition to the scientific exchanges that they've provided, they also provide what I'll call human interest stories about physicians that may be climbing mountains, may be developing cooking for cancer victims, or a particular physician's passion about a mission work or a particular cause. And what that does, it puts a human face on doctors and lets us know that we're all just people trying to do the best we can, and really has been a great boost to our sense of community among physicians, not only as physicians but as people. For the past 10 years, I've relied on the Birmingham Medical News to help me keep up with what's going on. I'm recently retired, and I spent 37 years of my life in practice in Birmingham. The Birmingham medical community means a great deal to me, and so I intend to keep up with what's going on through the Birmingham Medical News. The Birmingham Medical News has been and continues to be an important part of the fabric of the Birmingham medical community, and for that I'm grateful.